Hello, good morning, everybody. My name is Alejandro, and this morning we have the pleasure of being with Dr. Acuna. Dr. Acuna, you're the business owner of DPTSI and physical therapy, and we'd like to thank you for the opportunity of being with us for the interview section of my research paper. Okay, all right. So we're gonna go ahead and get started with the interview section. And for the research paper topic, we have the effects of prolonged exercise and sports on aging. As a therapist with many years of experience that has had the opportunity to work with multiple patients, tell me, what are some of the positive and negative effects of prolonged active lifestyle in functional capacity in the people that you have worked with?
Most definitely. So essentially, there's positive effects for movement and exercise, and there's also some negative effects. But I guess with this question, I just kind of went into just what does the positive effect of movement and what is the active lifestyle, right? Essentially, you have better endurance, you have better strength, you have better stability, right? You have better balance, better proprioception, right? So persons of especially the elderly age, they move around better and they can perform different kinds of sports or activities that are more comfortable to their age-related, lifestyles. Mm-hmm. But you maintain that healthy lifestyle, less risk of injury. You definitely have a better outcome if you do injure yourself because you already have the established strength and stability within your musculoskeletal system. Okay. So those are all positive effects. Some negative effects is that, with increased lifestyle or increased sport-related activities, mm-hmm. you kind of increase your risk for injury. Yeah. And so at that point, you can have like an ankle sprain or a knee sprain or hip fracture or something of that sort. So that's kind of a negative impact for it. But in all reality, there's not too many negative impacts in the lifestyle of elderly if you're active, right?
Okay. And, unfortunately, there is a large population of elderly people that, because of one reason or another, they do not have an active lifestyle. Do you think that is it ever too late for elderly people to start an active lifestyle?
Yeah, most definitely, and it's not. I think just culturally in our area, it's very easy to have a sedentary lifestyle, yes. Right? What do we have here locally to help encourage elderly persons to be more active and get out there? There's not too many attractions, right? There's not too many things that are like, hey, get out there. Although we're slowly starting to improve that, but it's never too late. It's never too late to get healthy, right? It's never too late to move, okay? What I have seen in my years of practice here is the sedentary lifestyle, the unhealthy, the diabetes, and all the other metabolic related type of changes in our elderly are really established because they just didn't have that education of how, mm-hmm. or they may have tried years ago, but never had the proper guidance, and so they essentially gave up, right? First and foremost, we're always going to suggest that you seek medical physicians to oversee, their advice on how or what you can and cannot do. Seek medical clinicians such as physical therapists that want to give advice on how to individualize exercise programs for you, not give you cookie cutter or just kind of like things that you can find on Google it's not a one size fits all kind of exercise program. But yeah, essentially it's never too late to improve. Now, most of the time with us, like being physical therapists, we're considered movement specialists, right? Yes. And I tell patients all the time that movement is medicine. So essentially people want to say, well, give me a pill for that, or give me medicine for that, or give me this. It's like, hey, before you know it, you've got a whole concoction of medicines you have to take. I've had patients that do 30, 40 pills a day, right? And it's like, hey, we could just kind of get you exercising and moving and getting some changes within your body. You're going to notice that you don't need all these, medication and interventions of that sort. So I don't ever think it's too late to get started moving. Okay, it will always improve your body and the lifestyle you have. But I do suggest you always seek medical advice prior, especially if you have not had any of this for many years.
All right. Okay, well, Dr. Acuna, we would like to thank you once again for giving us the opportunity to be with you this morning and for conducting the interview for my research paper. And we want to wish you the very best.
Thank you so much. Appreciate your time.
Thank you.